Amber was a 42-year-old lady presented to the clinical department complaining of recurrent attacks of severe, sharp, right temporal pain induced by cuffing or bending forward. The pain was maximal at onset, lasted for 1 to 5 minutes, and then declined to a mild dull ache lasting for up to about an hour. Amber has no past medical history of illnesses or injury before this condition, and she had no significant family history of migraine or other primary headaches. Her physical examination revealed sharp pains elicited by coughing, straining, or bending forward. She didn't have photophobia or nausea. There was a subtle right ptosis, but the pupils were isochoric and extraocular motions were full. Other cranial nerve functions were normal. Based on the patient's symptoms, past medical history, and physical examination, the doctors referred the patient to the neurology department, where further tests were taken for making a complete diagnosis. A head CT and CSF examination was performed, which showed abnormal results. Now, what type of results do you likely expect? How will you further move towards the right diagnosis? What suitable radiographic techniques will you perform to confirm the diagnosis? Which type of primary headache is Amber suffering from? And what treatment will be suitable for her? You'll be able to answer these questions when you have a complete understanding of Neurologia Cefalea. sqadia.com is bringing a complete lecture of more than 40 minutes on Neurologia Cefalea 2, along with short clips for quick learning. You can watch these videos on sqadia.com. To solve this case study, simply go to sqadia.com, subscribe, and get a free trial of 2 days.